Phlebotomy is the process of drawing blood by puncturing the vein, and phlebotomists are people trained to draw blood from a person or animal for tests, transfusions, donations, or research. The objectives of good phlebotomy practices are improve knowledge and awareness of risk associated with phlebotomy to the healthcare workers, to reduce blood-borne exposure and develop safe practices, improve quality of lab tests by reducing pre-analytical errors, and to improve patient confidence. Blood sampling systems are of two types: closed or evacuated blood collection systems and the open blood collection system. The closed or evacuated systems for blood sampling are preferable because they have been proven to be safer than open systems and provide better specimen quality. The added advantage of using closed system is that blood comes directly in contact with the anticoagulant, avoiding pre-analytical issues like microclot formation. The use of evacuated blood collection system reduces the risk of direct exposure to blood and makes it easier to take multiple samples from a single venipuncture. Although vacuum extraction systems are safe, training and skill is required for their correct use. The system comes complete with needle, holder, and the laboratory sample tubes with appropriate additives and color-coded caps. Needles are double-ended and available in several recommended gauge sizes indicated by color codes. The non-patient end of the needle is covered by rubber sleeves and is screwed into the barrel, also known as the tube holder. A thread separates the two ends of the needle. It is where the holder is screwed into place. The holder holds the sample collection tube in place and protects the phlebotomist from direct contact with blood. As the sample tube is under vacuum, once the needle is in the vein, the tube is pressed onto the non-patient end of the needle in the holder and blood is drawn automatically into the sample tube by vacuum until the required amount is collected. The next tube is then placed in the correct sequence without removing the needle from the patient. The needle and holder are to be discarded as a single entity. However, there is also an option of using reusable needle holder or a multi-sample needle holder which has a system to eject the needle after use. The evacuated systems may also be used with a winged butterfly needle and a lure lock connectors. Open systems include hypodermic needle and syringes and sample container, which could be vacuum tubes or non-vacuum tubes. The use of a hypodermic needle and syringe is the most common means of blood sampling. Assembling of needle and syringe involves opening the packaging of the hypodermic needle, that is, the back of the needle, keeping it capped. Open the sterile packaging of the syringe from the plunger end that is, back of the syringe, keeping the nozzle protected in the packaging. Carefully remove the syringe from the package and insert the nozzle of the syringe firmly into the exposed hub of the capped hypodermic needle. Leave the needle and syringe in place until ready for use. Selecting the gauge of needle. It is important to select the right gauge of the needle based on the age of the patient, amount of blood, and type of samples. For example, thicker gauge needles are used for coagulation studies. Use this chart to decide the gauge of the needle. There is a universal color code to identify the gauge of the needle. Selecting the gauge of the needle. For adults, all sizes of needles can be used, whereas in pediatric and elderly patients with thin veins, only the 22 gauge or 23 gauge needles are to be used. For neonatal, only the winged butterfly sets with 23 gauge needles are used. Procedure for phlebotomy. Assemble the required material. They are closed collection systems or open system with disposable sterile plastic syringes of various volumes, tourniquet, disposable well-fitting gloves, masks, 70% isopropyl alcohol swabs, betadine, dry cotton, band-aid, hand sanitizer, blood culture bottles, citrate tubes for coagulation test with light blue cap, plain tube with clot activator with red cap, gel tube with yellow cap with clot activators and gel separator, green tubes containing sodium heparin for cytogenetics and plasma-based assays, EDTA tube containing potassium EDTA with lavender cap, grey tubes containing fluoride for glucose, black tubes for ESR, specimen storage racks, needle destroyer, puncture-proof containers for sharp, biomedical waste color-coded bins, barcode generator or a permanent marker, computer with LIS system if available. Pre-collection verification and use of personal protective equipment. Approach the patient in a calm, confident, and professional manner. The phlebotomist must gain the patient's confidence. Assure the patient that, although the venipuncture will be slightly painful, it will be short in duration and necessary for the diagnosis and treatment of their healthcare problem. Answer any patient query related to laboratory procedure. Confirm the identity of the patient with the laboratory requisition form. Wearing gloves is mandatory before sample collection. Wear lab coat and mask. Cover all injured or exposed wounds or cuts with a bandage before proceeding for sample collection. Determine the best site for venipuncture. The common sites are antecubital area. Median cubital vein is the most preferred site as it is large, well anchored, least painful and least likely to bruise. Cephalic vein is the next preferred site. It is large but not well anchored and may be more painful than the median cubital vein. The basilic vein is the third choice. It is generally large, easy to palpate, but not well anchored. It involves the greatest risk as it lies near brachial artery and the median nerve. Either of each can be easily punctured. Dorsum of the hand. The veins on the dorsum of the hand have a greater tendency to bleed. In fat persons, however, it may be difficult to access an antecubital vein. In them, the veins in the dorsum of the hand are easier to reach. Alternate sites. Phlebotomists will not collect blood except under special circumstances from the arm or hand from the side of a mastectomy, unless all other sites have been ruled out, and only with written permission from the physician or nurse. Limbs with indwelling artificial access devices, unless all other sites have been ruled out and written permission of the primary care physician. Unacceptable sites. Phlebotomists will not collect from fistulas, shunts, arterial lines or locks, arteries, femoral vein, varicose veins, and the palmar region of the wrist. Venipuncture. Venipuncture procedure includes labeling of tubes, which may be done prior to or immediately after collection as per the policy of the institution. The label should be clearly written with at least 3 patient identities like age, name, unique ID number. After the patient is made comfortable and seated on a chair, ensure proper positioning of the patient's arm. Apply the tourniquet with 3-inch clearance above the planned puncture site. Ideally, the tourniquet should not be applied for longer than 1 minute at a time. Note: leaving the tourniquet applied for an excessive period of time, that is, more than 1 minute, may cause localized stasis, formation of a partial filtrate of blood, and hemoconcentration. These may result in erroneously high values for all protein-based analytes like packed cell volume and other cellular elements. For coagulation studies, avoid using tourniquet or apply it for less than 1 minute, as platelet activation may lead to coagulation testing errors. Clean the venipuncture site with 70% isopropyl alcohol swabs or sterile swab using a circular motion from the center to the periphery. Never do the reverse. Allow the area to dry before venipuncture. The puncture will be painful if alcohol has not dried. Hemolysis is also a possibility if alcohol gets into the sample.